Moderator today. Please welcome our speaker, Jia Jingwen, assistant to the general manager of Huiying Medical Technology. She's going to explain how they developed the AI-assisted CT screening solution to combat the COVID-19. Welcome.
Okay, thank you. So this is Jingwen from HY Medical. So we are basically a medical imaging AI company who is providing the AI-assisted solutions to the hospitals. So thanks for the introduction from Huawei. Now we can just have a brief session to introduce all the solutions we have been prepared for the COVID-19 cases. So now, actually, the WHO has declared the coronavirus, the COVID-19, as an epidemic. So the last epidemic reported in the world was the H1N1 flu epidemic 10 years ago. So at the beginning of the April, we already have over 1 million cases has been identified globally in most of the countries. So a global coordinated effort is needed to stop the further spread of the virus. Now, one of the primary tasks is how to identify and make a diagnosis of COVID-19 more quickly and precisely. Here actually is diagnostic procedures for the COVID-19. One of the primary testing methods we have been known is the reverse transcription polymerase chain reaction. We call it is Rtpcr. So now most of the countries are using this testing kit as the golden standard for testing the COVID-19 cases. And here I just listed some of the definitions from the WHO. So we defined it the infections from the suspected cases, probable cases, and the confirmed cases. So you can see from the definition, for the confirmed cases, actually a person with laboratory confirmation of COVID-19 infection can be considered as a confirmed cases. So no matter of the clinical signs or the symptoms. Now let's talk a little bit more about the Rtpcr testing kit, because every testing method has its advantages and also the disadvantages. So as screening tools, Rtpcr definitely is a very valuable screening tool. It can detect the virus at a very quick time and have a very high accuracy rate. But actually the weakness part I wanted to emphasize on is, first of all, not many countries now have the enough supply of the PCR testing kit. So the availability of the testing kit is vary from country to country. Second, for the sampling, actually we needed some professional technicians to do such sampling work. So the improper clinical sampling may lead to the error results. Third point is, so far we don't have a very standard global protocol for manufacturing the PCR testing kit. So that means right now in our hand we have the PCR testing kit from different vendors, which is manufacturing from the different standards. So actually the testing results may vary. And the fourth point is I wanted to emphasize on is about the false negative rates. Actually, the PCR testing kit has a high false negative rate. So because with the results varying, it's depending on when and how the samples were collected. So let's talk about the high false negative rate and how we can solve this problem. Actually, for the research and the papers is pointed out, for the sensitivity for the Rtpcr testing kit, it only can be around 60% to 70%. So let's take as a very simple example. Now we're going to testing 100 suspected people, and we're using the PCR testing kit. And then soon we find out, actually the PCR testing kit can detect the COVID-19 only for give the correct results is only for 60 to 70 people. But actually for the other 30 to 40 people, the PCR testing kit cannot give you a correct answer. So what if there is a few COVID-19 cases among them? Then actually we don't know. And those people is going to go back to home and infect their families and others. So that's why actually we bring the CT chest scan examinations on the table. So when the breakout happens in China, first at the very beginning, Chinese government also using the PCR testing kit as the only testing method. But soon we find out it's not enough. That's why in the trial version of fifth trial version, actually we added the CT chest scan into the guideline of doing the diagnosis and the treatment for the COVID-19. Now let's take a look at the chest CT scan. So what is the performance for the CT? According to the research, actually we're surprising finding out the sensitivity for the CT chest scan is better than the PCR testing kit. It can reach at 98%. So basically speaking, it's increased for 20% and above. So that's why in China and the Chinese government are recommended to using PCR testing kit plus CT chest scan as a complementary method to detect the COVID-19. Here, I wanted to talk a little bit more and share more experience about how we do the diagnosis procedures to confirm the COVID-19 in China, especially in the hospitals. So the patient usually has some clinical symptoms, like they have a fever, they have the shortness for the breath, then they're going to send to the fever clinic in a hospital. And then the first step, the doctor is going to take their epidemiological history of them. So they're going to ask whether they have been traveled to some high-risk regions, have they been exposed to some confirmed cases, etc. If they have those epidemiological history, then the next step we're doing is to perform one CT chest scan, also a blood testing. So if there is any new onset pneumonia found on a CT, and also the results of the blood test is abnormal, then we actually defined it. This is a suspected case. Then we are doing the different level of the quarantine immediately. It can be at home quarantine or in the quarantine hospitals. And then the third step, actually, what we are doing is to doing the laboratory testing for the COVID-19. Here we can using some PCR testing kit, or we can using the viral gene sequencing or the other testing methods. If the results showing is positive, then we defined it as this is a confirmed cases. And then we're going to transfer this confirmed patient to COVID-19 assigned hospitals. So this is how we do in China. And also we recommended if we're putting the CT chest scan at the fever clinic, then we should allocate one fixed CT scan for using. And we also recommended to using some remote control for the CT scanning, so to avoid the cross infection between the doctors and the patients. After talking about the CT, now let's talk about how the AI can contribute to the diagnosis on the CT chest scan. I know there are some challenges for the radiologists to diagnose the COVID-19 only based on the CT chest scan. There because some reasons. So the first, actually the COVID-19's pneumonia, the imaging pattern is non-specific compared to the other types of the pneumonias. So they have overlaps with the other infections. It's very hard to identify them only based on the imaging findings and patterns. And also now for the diagnosis, actually it really depends on the interpretations for the individual radiologists. Some of the qualified and with years of the experience of the radiologists, they can better recognize and identify the pneumonia cases. But for the junior radiologists with less experience, then it's hard for them to detect. So that's why we need to solve these challenges and the problems for the radiologists. So that's why we're bringing the AI technology to solve their problems. So let's see how the AI can contribute on this. You can see the slides I'm showing you is a user interface we presented to the radiologists. So basically is after the patient is finishing the CT chest scan, then their CT studies is going to send to our AI server at the back end. Then the AI is started doing the calculating and the analysis. Then we will present this user interface with the AI analysis the results to the radiologists. So different from the normal PACS viewer, actually we're providing some extra informations. First of all, you can see in the left side of the user interface, we are giving a probability of COVID-19 for this individual case. So this number can ranging from 0 to 100%. The higher number means AI think suggests this patient may have a higher probability of COVID-19. You can see from this case, actually the percentage is over 93%, is quite high. So actually the AI is giving an alert or references to the radiologists. Secondly is the AI can help the radiologists to detect and annotate all the suspected pneumonia lesions on the CT chest scan. So you can see from in the middle of this user interface, actually the AI is annotated the suspected pneumonia contours with the green color and share to the doctors. And for every suspected pneumonia contours, actually will list all the detailed information in here, like what is the layer and also what is the location and the type. Is it a GGO or it's a consolidation with GGO or it's Apache GGO, etc. The types information we are showing here, and also with the volume information. And next is about how to help the radiologists to do the diagnosis in a very efficient way. So basically, for one radiologist need to reading those cases, at least they need 10 to 15 minutes. But after they're using our AI technology, the AI can help them to analyze these cases only within 30 seconds. So it's actually improved the efficiency for the diagnosis for the radiologists as well. After talking about how the CT and the AI can contribute to the diagnosis part, let's take a further step to see from the diagnosis part what else the CT and the AI can do for fighting the COVID-19 cases. Actually, for after the confirm the patient is a COVID-19 patient, there is a few things we can also be performed. For example, like the treatment and also for the follow-ups. So when this patient has been transferred to the hospital during the treatment process, this patient needed to perform at least 2 times of the CT chest scan. The reason is actually the doctor need to evaluate how severe the lung has been affected, and also they have to know how the diseases is evolving, and also they have to, based on those findings, to make a better treatment decisions. So that's why the CT chest scan actually plays a very important role during the whole process of the disease course management. You can see from the treatment and the follow-up part, the CT can help the doctors to do the detection of the lesions, evaluation of the lesions, disease severity assessment, and also the clinical classification. And now let's talk about how the AI can help on this part. So from the treatment and to the follow-up processing, actually the AI can help the radiologist to tracking the volume change for the suspected pneumonia lesions. So before, the radiologists are just using their individual experience to evaluate the volume size or the other informations. But now, actually, AI is providing them with the quantitative information with accurate detail for helping them to do a more precise treatment plans. After talking about the product, now let's consider about how these AI solutions can be deployed in a real environment. So basically, we're providing two solutions. The first solution is we can deploy these AI applications on a public cloud environment. First of all, we are collaborating with the Huawei Cloud together, so we can install our AI applications on the Huawei Cloud side. Then, for the connection between the cloud and the hospitals, we're putting a small front gateway server into the hospital side. So basically, this is front gateway is like a mini PC, which installed with our software on inside. And then we're putting this to the hospital and connect with the hospital's intranet. So the next step is this front gateway actually can connect with the PACS or the CT scanners directly. So when the patient has been finished the CT examination, the images actually can be sent to the front gateway. And then the front gateway is going to processing and forward all those informations to the cloud site. Because of all the system here is browser server based. So for the radiologist and the doctor, they don't need to download any plugin or client side. So they just need to using the Chrome browser, and then they're typing an address with the account and the password we're given to them. Then they can be able to access to the AI results. And for the hospitals to transfer the data onto the cloud side. So that's why we have listed some security measures we have been done to protect the imaging data. So first, from the PAC side, actually this is the hospital's decision to make to actually can setting on the PACs what type of the images they actually wanted to transfer to the cloud. So this is the hospital's choices, it's their option. Second is about the transmission between the PACs and the front gateway. Actually, this is an IP-based direct transmission. So means it's one way out. We're never gonna to send anything to the hospital side. And for the front gateway, it's not only to forwarding the images to the cloud, it also to do some anonymized work on this server as well. For example, if the hospitals are concerned with the data security and the privacy, then they can remove the patient name or even the patient ID from the CT studies. And then after anonymizing, then they can transfer to the cloud. And also for the transmission part, we are offering with the HTTPS access with the authority control. And if the hospitals have the requirements, we can build the VPN internal with partner together for the hospital to use. And also for the cloud side, actually we can ensure that the data security on the cloud side, and also the Huawei cloud is going to protect the whole data at the infrastructure level. For the radiologists and the doctors, they can just need to access this secured terminal and then to uh, enjoy the AI results and the analysis which provided by H1 Medical and Huawei Cloud. After the second solution, actually, the second solutions we're offering is the on-prem AI servers. So instead of transferring the data onto the cloud, we are offering the Huawei Atlas server with the GPU card. So this is an all-in-one server with our AI applications installed. So we can put this powerful AI server into the hospital site. So they can connect with the hospital's CT modality or the PACS system to receiving the CT studies. And then they can do the calculating and the processing. The doctors, the radiologists, they just need to access in that server without going to the internet. So basically, this is the second solution we can provide it for the hospital. But we can do a little bit of comparison between the cloud solution and also the on-prem solutions. First of all, for the cloud solution, it can be deployed very fast because all the installations is based on a cloud, and we can do all the processing. So it's really suitable for the emergency situation, especially for this COVID-19 cases. And on the last part, I wanted to share you with some case studies we have already done, not only in China, but also globally. So first of all, we started to deploy this system and all the AI services in China. And last month, we already entered into 20 plus hospitals in China. So basically, because China is using a lot of the CT chest scan screening for the suspected patients. So we're helping them a lot to doing the screening and the diagnosis for the COVID-19 patient. And that's why is another reason why our AI algorithm has a very high sensitivity and also the specificity. That is because the AI algorithm has been studied 4,000 plus confirmed COVID-19 CT studies. And totally, we're using 17,000 CT studies to train this model, which we already included 3,000 plus other types of the pneumonia. And I think it's on the beginning of the March, we started to deploy these AI solutions globally speaking. So for now, we already deployed it in over 20 countries and over 30 hospitals worldwide. So basically, we're focusing on three regions. First is the European countries. So, for example, like the UK, Italy, Belgium, Russia, etc. And also, we're providing solutions for the South Asia countries, especially in Singapore, Thailand, Malaysia. And also, there is a big requirement from the Latin America countries. So now we have been covered with Mexico, Chile, Ecuador, Panama, Colombia, Peru, Panama, etc. And here I can share with you with some case studies. So this is actually we jointly released our product into one of the biggest hospitals in Malaysia with Huawei Cloud and Malaysia Ministry of Health together. And this is when we jointly release the AI solutions for one of the advanced hospitals in Thailand with Huawei Cloud and also the Digital Economy and Society Ministry of Thailand. And last case study is we have been deployed the system in 2 hospitals in Ecuador. And their vice president of Ecuador actually posted a Twitter and then to say it's clear to say that the Ecuador is the first Latin America country who has been used the AI assisted diagnosis solutions for helping them. Yeah, that's pretty much of the introduction for the COVID-19 solutions. We hoping that these solutions can helping the frontline in the hospitals with the doctors and the radiologists together to fight the war of the COVID-19. Thank you.
All right, thank you, Jingwen. Thank you for insights and commitments. It's really informative. And now I see that we've got many questions from our viewers online. Jingwen, it's your turn.
Okay, thank you. Let me check about all those questions. Okay. Okay, can we using the CT studies instead of, okay, can we only using the CT chest scans even if we don't have the PCR testing kit? Okay, thanks for the question first. I think we can consider this in several aspects. First, PCR testing kit is definitely the golden standard for detecting the COVID-19. But we realize this has the limitations for those testing methods. So that's why we're bringing the CT chest on the table. But actually, how the CT scan can help for the hospitals, we can considering the CT. Actually, we are recommended to using the CT because imaging may be useful in identifying patients with COVID-19, which is especially relevant in places with good access to the imaging technology, but poor access to reliable and quick laboratory testing. So we need to get everything we can use to fight for the COVID-19. And we also know there is really some shortcomings for the CT chest scan, for example, like the radiation exposure and also the cost. But I think those small and long-term risk should not to begin to compare with the instant harm of releasing the COVID-19 to our community. So basically, what is our recommendation and also the recommendation and the experience we have in China is what we recommended to using this as a complementary method to do the diagnosis for the COVID-19. Yeah. And let me see, what about asymptomatic and the pre-symptomatic infection? Is CT scan working? Okay, thanks for the question. Actually, for the asymptomatic, I think there's a definition means that the patient during the whole process of the infection, they never developed any clinical symptoms. And for the pre-symptomatic is they haven't got any clinical symptom yet. Yes. So based on this situation, actually now we didn't have very much understanding about those 2 cases because they have not been routinely examined by many countries. So how to do the diagnosis and what is the transmission and the infection for those groups currently is not well understood. But there is some studies actually showing that the patients may have the abnormalities on chest imaging before the onset of the symptoms. So again, actually, how the CT and AI can help to do the diagnosis is actually based on the imaging findings and patterns. If this patient can have some new on-site pneumonia contours or lesions which can be showing in the CT images, then actually the AI can help to find it on those imaging patterns and to give a probability to actually give a reference for the radiologists and also the doctors. So this is how the AI can help. Yeah, hope that's answer your question. And next question is on how fast we can deploy the system. Okay, um, so previously I offered the two solutions we can provide it. So the first one is the cloud solution. First of all, it's actually very fast to deploy because once the cloud environment is ready, we can instantly install the AI applications on the cloud. And then the next part is where we need to putting the front gateway into the hospital to connecting with our CT and the PACS. So that needs the collaboration with the hospital's IT department together, but it won't take a very long time. So after that, because the system is all browser based, so you don't need to set up with the client side. It can be used very fast. The second solution is the on-prem solution. Then that means we need to prepare with the AI server. Then we are doing the shipment to the hospital side. It really depends on the real situation for the all the shipment and the transportation in the local countries. But the two methods were all supported. Uh, can you describe more about your algorithm? Okay, for our AI algorithms, so I can start it to describe it from the dataset we'll be using. So totally for the training dataset, we are using over 17,000 plus CT chest images to do the training. So among them, we're using 4,000 plus confirmed COVID-19 cases, and also 3,000 plus, which is confirmed by the other type of the pneumonia, that including like the non-COVID-19 viral pneumonia, bacterial pneumonia, gram pneumonia, etc. And also we're using 10,000 normal CT chest studies inside of it. So for a little more introduction about the COVID-19 cases, actually we're collecting them from 19 hospitals which located in 10 different countries in China. So this is the summary for our trained dataset. And for the performance on that, we also do a validation dataset to verify this. Basically, there are three tasks. So the first task is the classification of the non-COVID-19 cases or the COVID-19, and the other is to identify the pneumonia or the non-pneumonia cases. And so the sensitivity and the specificity are very good. Both of them are over 95, and for the DICE score is also over 85. And let's see next question. Okay. So can the CT chest imaging showing some findings to the different for the patients in different phases? Okay. So in the radiologist or in the academic terms, actually there are we defined some changes and the features for that. So basically, the typical imaging findings for the COVID-19 is the ground glass opacities. We call it as the GGO. So it's usually is bilateral and in the peripheral location. And sometimes we also have some crazy paving appearance and the airspace consolidation, etc. And we actually to classify and categorize this for 4 stages. So first stages is we call it the early or the initial stages is usually is 0 to 4 days. So that can be performed like normal CT scan, just like I mentioned before, it's like asymptomatic patients, or the GGO only. And then it is gonna to develop to the progress stage. Usually is 5 to 8 days. So that means we can get more increased GGO and the crazy paving appearance. And then is the peak stage. Usually is from 9 to 13 days, and the most imaging finding is the consolidation. And then the last part is the absorption stage. This is over 2 weeks. Then actually we can see improvement in the disease course, and the most typical imaging findings is the fibrous stripes. So basically, the radiologist is identify different stages by seeing different imaging patterns on that. And this is how the AI can actually help to detect, because they already studied thousands of the confirmed images. So they learn the imaging patterns very well. And actually they can offer a immediate answer, typically in the time window of the picking signs and the symptoms. So this is the how to work in AI part and also the CT chest part. Yeah. I think that's pretty much of it. Thank you very much.
All right, thank you, ladies and gentlemen. Thanks for joining us today. Thanks for showing interest. This is the end of today's Huawei Cloud Live. In fact, Huawei Cloud is committed to working with all of our customers and partners from all over the world to find innovative solutions to mitigate or minimize the impact of this virus. So please don't hesitate to contact us if needed. Thank you very much.